Well, thank you very much. I just wanted to take a couple minutes to update people on what we've been doing in the city to address the coronavirus and uh, um, COVID-19. I've been meeting regularly with sanitarian John Garside and Patty Moran, our head nurse. We've been having regular discussions with different department heads, and also been meeting regularly with Mike Bergeron, the superintendent of schools, to make sure we're all on the same page and moving forward with the same information. We just got off another call from DPH to update us on what's going on statewide, and both Patty and John have been on numerous phone calls, as well as the superintendent and myself, to try to stay on top of this. Went to the Board of Health meeting, and we were really happy that Dr. Joe Tennyson from the Marlborough Hospital and on our Board of Health kept us updated on what's going on in the hospital, and also was at the meeting today that we had with DPH, and also asked Chief Breen to implement the emergency preparedness team. And really what we're doing in the city of Marlborough is to be prepared when something happens. Hopefully this is something we're preparing for that never has to get put into place. But we know that this is a serious disease, serious illness that's going throughout the country, and it's really been something that is going to impact our senior citizens and people that have particular risk factors. Lung diseases and those types of things are of particular risk in people over 65. We've asked our custodian staff in the city, in City Hall, in our senior centers, and throughout the city buildings, in the school system, to put additional precautions in and do additional wipe downs. We've allowed them to add to their daily routines and put in whatever overtime is necessary to get the schools and the buildings in the city satisfactory. We've also implemented some sanitizers in City Hall and up at our senior housing complex. So we are taking regular precautions, and I would ask John Garside to give us a little update from the health department.
Thank you, Mr. Mayor. As you probably know, we have 92 cases of COVID-19 in the state, 91 presumptive and 1 confirmed. Here in Marlborough, we did get our first presumptive case last evening. That person is doing well, I'm happy to report. We are monitoring a couple contacts of travelers from level 3 alert areas as defined by the CDC. And those folks are also doing well, and their quarantine will be lifted tomorrow and then a week from tomorrow, should they continue to show no symptoms. As the mayor mentioned, we're most concerned with folks with underlying health conditions, folks immunocompromised, folks and the elderly, obviously. But in regards to the healthy folks, 80% of these cases are healthy folks that have a mild to moderate illness, so it's comforting in that regard for some folks in better health and of younger age. Regarding events, that's case-specific, event cancellation going forward in regards to the nature of the event, the distances that are able to be maintained at the event. So there's no catch-all cancellation at this point in time in regards to events. It's really make your best decision, as it develops with planning, obviously. If you're an important person and you can't afford to be quarantined, just take that into consideration when you're planning your day or making your schedule in regards to certain things. So, as the mayor said, we've implemented stricter cleaning schedules on some of the municipal buildings. We meet daily with the superintendent, the mayor, myself, and almost daily with the EMS folks. We've reached out to administrators at private schools in Marlborough, food establishments, as well as the municipal departments in regards to modifying their behaviors, as well as modifying their cleaning schedules and such to be best prepared to respond to this COVID-19. Communications with DPH are good. The volumes are tremendous, as you might imagine, in regards to, as the mayor mentioned, we had a conference call at 3 o'clock this afternoon, which is very informative, but it also shows that everyone's in the same boat in regards to getting their questions answered, and the policies are still developing. They're etched in stone today. They may be different tomorrow. So we're all just trying to get you the latest and greatest information as we know it and as it develops. I think that's all I have. I'm going to have Patty Moran, our public health nurse, just speak a little bit to some of the school stuff in regards to her work that she does with public nurses in the schools, if she would.
Hi. So, as everybody has said, we've all been working together daily, all right? So, ordinarily, I do work with the schools, and we have a great school nurse leader. We have great school nurses in Marlboro. And they have the trust of the parents here, okay? So, they've been doing a great job with answering questions, all right? We want to emphasize that parents, you know, yes, it is a concern, but if a child is, you know, it's mostly a concern, again, just as with the elderly, with a child who may have a disease or an underlying condition, may be immunosuppressed for whatever reason, okay? That child, you know, I have one of those children in my house, okay, my grandson, and a doctor from Children's Hospital said to my daughter, would you send your child, okay, if they were sick, to infect another child, or if there was a outbreak of anything going on at the school? No, you'd want to protect them, okay, and you'd want to protect other kids. So it's important that you keep that perspective, all right, even though this is a serious disease. We want to make it a little bit more real to you, okay? The school is more, you know, the school nurses are more than happy to get any communication from the parents, okay, about the status of their children. And there's a lot of information out there, even from people's parents' businesses, everything, okay? So, and we don't know all that, okay? We only know what we deal with as your health department, okay? So we may not have the answer. So make sure that you check with your PCP, your child's PCP, all right? And check with us, okay? But don't ignore any advice that's been given to you, okay?
Patty, maybe could you just speak to the differences between what some of the institutions are doing and sending folks home to work versus a quarantine as we define it?
Yeah,
Please.
so quarantine, the difference between quarantine and isolation is really simple to remember. Quarantine happens when you're not sick. So even though you hear, oh, there's all these people that are quarantined, what's the number now? Like,
700.
huh? Yeah, home quarantined, and you'll see it posted on the mass.gov site. Remember that those people are not sick. We're just monitoring them for symptoms to make sure they're not becoming sick and that they get assistance as soon as they can, all right? It's nothing to be afraid of there, all right? If they are sick, okay, then they would be put in isolation, okay? And isolation is just a step up. And some of the people have been put, even though they're sick, with this particular disease, they go home, okay, to be monitored still, okay? So then that word, I think, is being switched off with quarantine, all right? But it's really, you know, it's a step up, but they're not having any symptoms really, and again, they're just being monitored, all right? And people are watching them, all right? The primary cares are watching them, and we are watching them here, and they're reported to the State Board of Health, so they are watching them, okay? Did I hit on all the scenarios? Oh, home when some people say that work from home, okay, that's a policy, okay? So somebody says at their business, we want you to work from home for 14 days, that's a policy, okay? Yes, it's a type of quarantine, and they all have many different reasons for it. Some companies do a lot of travel, some don't, some have a lot of meetings, okay? We don't know all those reasons, but basically that's a policy, okay? It's different than us telling you you have to be in quarantine or your doctor or the state. Make sense? Good. No, excuse me.
Thank you. I just want to remind everyone, use common sense. If you're sick, stay home. If you're not feeling well, stay home. If you're someone that has some of those illnesses that we're very concerned about, already have a cold or have some lung disease or other areas of concern, stay away from people as much as possible. This is something, as John said, we have one presumptive positive in the city. And as testing takes place, we're going to see more of that. But we're asking people to be, vigilant and use some common sense in this whole thing. And be self-reporting. If you are involved in the schools and you're not feeling well, or your students not feeling, or your children are not feeling well, let the schools know you're keeping them home, and these are the symptoms. So we can follow up on it through from our health department in the schools. We're just trying to identify those pockets, and again, stay away, at least stay away from events if you're not feeling well. So with that, I'll open it up if anyone has a question. No, go ahead.
Hi, thank you. I'm Bonnie Adams from the Community Advocacy newspaper. I just have a couple of quick questions, if I could. Will you still be holding your gala this weekend?
We are holding the gala, and as we did today down at the senior center, we're giving people the option that if they would like to not come and change their mind, we'll be happy to refund their tickets. And we also want to tell people that if they are not feeling well, we'd love to have you skip this one and look forward to the next one. And hopefully people are greeting that night, instead of with a handshake and a hug and a kiss, maybe just a nice smile. So, yeah.
Are you doing anything there with places like New England Sports Center and the Apex Center, which obviously gets so many people coming from so many different places?
No, I've been in contact with West Tuttle down at New England Sports Center and the hotels to find out, okay, what's going on, really to get updates from them. They've seen a huge drop in, obviously, their occupancy down in the hotels. They're down substantially because most of the businesses have stopped traveling. And New England Sports Center, I told them, we need to know if you have groups coming in from areas that are of concern. So he doesn't want to deal with it down there either. So he's going to look at those tournaments coming up. We actually have a department head meeting tomorrow. We're going to be telling them the same thing. If you have any plans for traveling or we'll be doing any events in the future, this has to be a top priority to think about as you're making your decisions moving forward. So this is something that we're going to live with for a little while, and we have to figure out how to deal with it. But we're going to be prepared for anything that happens in the city.
Can I add to that, Mr.
Yeah.
Mayor? So I've also spoken with the folks at Apex as well as New England Sports Center, and as I called them and picked up the phone, they quickly responded that we've already picked up our cleaning and sanitizing routines. We've been out bringing them signage to hang at different locations throughout their buildings, but what we've seen is folks have been proactive even without our nodding or us calling them. They realize, and it seems like the community understands what their responsibilities are.
John's also been in touch with the other school systems in the city. We have several other school systems with Meyer and AMSA, the Assabet school system, IC, and Hillside, just to make sure, again, we're all on the same page, and if something comes up at those, they need to contact us. Yeah.
Do you know if this presumptive positive case was related at all to the Biogen conference?
I can't comment on that.
No.
Just guess.
Anything else?
It's that
Yep,
one more question.
sure.
Could you just speak a little bit about your communication with Marlborough Hospital? Are they acting as a partner with the city in case there is like an outbreak here, or this one person, of these several people who are presumptive at this point, turns out they need more emergency services?
There's no question about it that we've been in contact with them. In fact, Dr. Tennyson, that's on our Board of Health, is an MD at the hospital itself, so he's been a great asset to us and bringing us additional information and what they're doing up there to be prepared for people coming in and how they're going to deal with it in their waiting rooms and welcoming people. So absolutely, I mean, that's one of our gems in the city, and we want to make sure we utilize them as an asset. Yeah. Jeff, all set? Good. Anything else? Thank you very, very much, and let's get good information out there so we're not all guessing. So, thank you.
Thank you.